Hi everyone, my name is Michelle Claycomb. I'm a physical therapist at Madonna. I've been a physical therapist for probably about 19 years, I think it's been, maybe closer to 20. I've been at Madonna for 14 years, a little over 14 years, and for probably the last 6 years, I've been the leader for the safe patient handling initiative that we have there. Today, I have brought a few things with me to kind of show you to help hopefully prep you for your experiences down the road. I do encourage you, as you get out into the clinic and work, to always be thinking about working smarter, not harder. And if something is working harder, then maybe finding a tool that you could use or a piece of equipment or something like that to certainly help. Because certainly occupational therapy is kind of about that anyways, about using tools to help your patients be successful at whether it's getting dressed or accomplishing a task in the bathroom or the kitchen or whatever it might be as well too. So kind of working on that energy conservation, but then also in your profession, helping you to be smarter about it and not having to put yourself at risk for injury while you're helping those individuals. So anyways, I have some stuff here. One of the things that you might come across is a slide board. And these are really nice for bridging those two different surfaces, whether it's a wheelchair or a mat or a bed surface, that type of thing. It gives a patient an opportunity to be able to participate more if you're needing to have them scoot across a surface but needing extra time, or if you're working on kind of that weight shifting forward to help them access their legs or use their legs a little bit more, but they can't come to a complete standing position. With any type of mobility skills, you do want to encourage your patient to do as much as they can to participate, but then also helping them to realize the movement that they need to be able to do. A lot of times we want to help so much that we just do for them versus asking them to participate. So cueing them for the participation, but then also telling them what you're doing too is going to help in the long run, getting them to do more as well versus just trying to manhandle them. So slide boards are nice. They come in different lengths. They can have weird shapes to them depending on what surfaces you're maybe trying to go to. So certainly something to maybe check out as well. If you have a patient that's more dependent and they're needing to use like an overhead lift, whether it be a ceiling lift or a floor lift, this is going to be kind of your basic horseshoe sling. You can kind of see it kind of looks like a horseshoe at the bottom. There's a flat side on one side, and then on the other side there are loops. The loop side go away from the patient. So this is the side that would go next to the person. They do come in different sizes, so depending on where you work, you want to make sure that you grab the right size sling for the right individual that you're having. You don't want it to be too small or too big, because certainly it could be to the point where somebody maybe could fall out of it if it is the wrong size. And it's definitely something that you don't want to have done. Typically, to hook up the sling on the lift, you're going to use these on one of the hanger bars, and then the straps at the bottom are going to be hooked up on the other part of the hanger bar. You certainly can have just a 2 hanger bar, or you can have a 4 hanger bar. So depending on the lift system that you're using, you can have 4 or 2, and certainly you can just hook them up depending on however number of hooks that you have. So typically with a horseshoe sling, you're going to have one strap feed through the other strap and crisscross before you hook it up to the hooks on the hanger bar. So if I was sitting, I'll show you real quick what that would look like. Also, the sling part, the horseshoe part down here only goes towards kind of the tailbone. So it doesn't actually have to go underneath the gluteal folds, but just towards the tailbone or just to the seat of the chair. So if I'm sitting, you're going to have the straps come up through the legs like this, and then this is where you're going to cross those 2 loops to hook up to the sling or to the lift system, and then you have this part that comes up behind. Now this sling probably is actually a little bit small for me, as you can see when I bring it up over, maybe. Up and over. It doesn't quite get me it gives me a little bit of head support, but it actually should maybe be about right here, just so that you know that that's kind of where it needs to be to kind of help that individual. So you're going to have this part hooked up to the lift system, and then you're going to have this part hooked up to the lift system. So it's almost going to kind of hammock them into the system. And then depending on where you put the lift system on the loop straps, depending on your lift or your sling, might determine if they're going to lay back a little bit more or if they're going to sit up a little bit more in that sling. So again, thinking about trunk control, muscle spasms, tone, that type of thing might determine what you're going to put the hooks on to help that patient be in a better position. If you have somebody who has maybe a lot of flexion tone or something like that, you certainly wouldn't necessarily maybe want them sitting up more right because they might fall forward more. So just kind of things to think about as well too when you're using one of these systems. From a therapeutic standpoint, sometimes you have to work on sitting balance. So you might use the sling to get the person from the wheelchair over to the mat. And then by using the system, you can keep this part hooked up to the lift system that you have, and it gives them something to kind of recline back into if needed to allow them to rest. So they're not necessarily having to rest on another person, or if you don't have another person to help you, that gives them some support that you're not having to then work to do to hold them up during resting. It then allows you to then help them come forward, maybe if you're working on some reaching, but then again, have that system that's already behind them for that extra safety and that stability that they might need while they're working on some trunk control. So kind of a use for that, but then also to kind of help be able to be therapeutic as well too, versus just this dependent lift system, okay? So that's the horseshoe sling. They do certainly have different types and styles of those too. So just kind of making sure that it's appropriate for the patient that you have that you're trying to use it with. All right. Next I have with me a different kind of sling like this. They come in different sizes, shapes, colors, just kind of depending on the vendor that you have, but this is called a limb sling. A limb sling is great for a variety of different things, probably more than you might think. So some of this stuff is more or less kind of thinking outside of the box. But again, a limb sling is great because you can use that overhead lift again, or that floor lift, to kind of help support a heavy arm or a heavy leg or something like that that you might need to do a dressing change on. Or sometimes nursing comes to us, or you hear nursing saying, I'm having a really hard time doing A, B, or C, or whatever. And you could be like, hey, maybe you should try using the limb sling to help hold the leg or the arm for something. Another thing that you can use the limb sling for, which would be great, is maybe helping with pericares or catheter insertion or cathing or something like that, that you might be maybe assisting with learning how to do independently or that type of thing. Certainly this could be used at home as well if you're working on a lift system at home. So again, you're gonna hook this up to your system and it's gonna help you hold that leg up wherever you might need. You can do it with the person laying on their side if needed. You can have them laying on the back. It could be a variety of different things that you could use this for, to even help go through some range of motion if you're trying to take weight off of it and just kind of have it in gravity eliminated position. So again, a variety of different things that you could use with this as well. I'll show you another technique here in just a little bit with this, but again, variety of different things you could use. Also, if you're working on some sit-to-stands with somebody and you maybe needed a little bit of extra boost, you could kind of tuck it behind them like this, and then you got a couple of handles here that you could help pull those hips forward if you're working on having them kind of do more some hip extension. If they have a tendency to kind of stand with their butt sticking out, this would certainly give you a little bit more leverage at the hips to help pull them forward, other than something like a gait belt that has a tendency to move and slide around a lot. Or if they had something going on here that you couldn't get the gait belt where you wanted it to be beneficial. So again, something to check out. You might not necessarily have one of these at your facility, so maybe be looking for something else that potentially could be used. At Madonna, we have another lift system, a sit-to-stand system called the Vera. It has a sling that just comes around the torso like this, and then it hooks up to a machine to have them sit-to-stand assist. Sometimes we use that sling to to help hold the heavy limb, because it has straps like this on either end, and it's a little bit wider. So certainly there are a variety of different things that you could use for your with your lift systems as well too. Okay, next I have a repositioning sheet. These are made for Madonna, but certainly if you look at vendor websites and stuff like that, you're going to see lots of different repositioning systems. This one, for example, has, I believe it's 5 of those loop straps on either side. This is intended to be used with an overhead lift or floor lift to help with rolling or repositioning up in bed. So we're really discouraging people to grab onto that sheet that lays on the bed to heave-ho them up in bed. There's a lot of studies that have shown that that's really hard on your overall shear of the spine, pressure, stress, that type of thing between those discs and stuff like that too. So keep that in mind as well too. So with the repositioning sling, your patient would lay on the sling, and then you're going to hook up your different loops to that lift system. And then when you use that lift system, it's going to help you raise that individual up off the bed to then allow them to be repositioned up over that type of thing. If you have a chance to ever use one of these, I strongly encourage you to do it. They're really great. If you've ever manually just boosted somebody up and then tried this, I guarantee you probably are going to be like, oh my gosh, that was so much easier. Besides, also think about your patient's comfort as well too with using some of this stuff. So is just grabbing onto the sheet and boosting them up really quicker and faster? It probably maybe will be. Especially since time seems to be one of those biggest barriers. We don't have time to do that type of thing. But if you think about overall safety and how many times you're going to be doing that per day, really give this a try, or in a sense, value your work and your patient's work as well too, and maybe speak up and say, we really need something to help manage these people better with this repositioning. So anyways, give that a try if you ever get a chance. The nice thing about this too is that if you just hook up one side, it works really, really nice just to help the person roll. And if you can kind of see, if my hand was the lift system and I'm rolling somebody, I'm getting a really nice offloading of that individual. And so it makes it really easy to just stuff pillows underneath there, versus now I'm having to call my coworker in and we're having to dependently try to really roll somebody. So somebody's pulling towards them or they're pushing them around, and then you're trying to stuff that pillow underneath them as well to kind of help offload them. And with that, rolling is really hard, especially if somebody who doesn't like to roll to a particular direction. So in a sense, using that to help offload them to get that pillow underneath there to help with that skin integrity. Just another tool that potentially could be used with that. Also with the repositioning sheet that we have, and then going back to that limb sling, again, we can use that device to help us manage a pannus. So if you have a patient that's laying in bed and again, you're having to do wound cares or peri-cares or something like that, and you're having a hard time managing that pannus, there's a way that you can hook up this system with the loops and then up to the lift that can help kind of manage that pannus. So it would help.
Explain pannus.
Oh, okay. Farrah said, explain pannus. So pannus would be something, so pannus is like a large kind of abdominal appendage in a sense that would hang fairly low. And so in order to get to maybe a skin fold underneath or kind of the peri area, you would have to pull that skin and that tissue up in a sense. You might, it might, depending on the position of the person, it's going to be distributed in a different way as well. So laying down, sometimes you might have seen or you might see stuff kind of push or pull on it. That can be very uncomfortable for individuals. So sometimes using some sort of device to help managing and pulling it up to hold it to allow for access to that area could be beneficial. Those static holds are going to be what's really going to kind of get you. If you ever have been in a situation where you have to hold something for a really long time in one position, you're going to know that that static hold gets really hard. And then you might try to start moving and weight shifting, stuff like that, but your arms are potentially going to give out and your back's going to feel it too, because we start holding our shoulders up and our neck funny and our back funny, especially if we're holding something like this over a bed. So really think about your positioning as well too when using equipment and helping your patients too. Okay. The other thing I have is called an FRD, or a friction reducing device. They come in different, again, sizes, colors, brands, that type of thing. They all typically they all typically work the same way. And a lot of this stuff too that I'm showing you comes in multi-use, but also disposable as well. So keeping that in mind too as you get out into the clinic is what you have, because sometimes it might be as easy as just putting it in the dirty laundry and having it cleaned and grabbing a new one, versus another one having to be charged and issued to that individual. Some of the things can't be laundered, and so some of them have to be wiped down as best they can because they are single-use items. So just kind of keep that in mind too as well, depending on what you're doing with the person. But anyways, these friction reducing devices are kind of nylon-y. They slide really well together. Again, friction reducing device, that's kind of the role, is to reduce the friction of the task that you're asking either your patient to do or you're performing with that individual. They come in different sizes and shapes, like I said, but they also you might see them being looped. And so looped means that they're going to be kind of in a circular fashion where both ends are sewn, or so you're going to have like a loop. I personally don't care for the loops. That doesn't mean that they don't work for some people. You just have to make sure that the loop's going the right direction that you're wanting to move that individual. I prefer much more having the two separate sheets to use. So this would be another great device to use if you're wanting to reposition somebody up in bed, or encouraging them to help you reposition. So you got your two sheets together that you have. You're going to lay it on your bed surface. And then you just take the top sheet to slide the person up. Now there's techniques that you can do to get it underneath the person without having to roll them, or you can roll them and kind of shove it in and then have them roll and pull it out the other side. But we can certainly talk about that at another time. I just want to more or less show you kind of how slippery they can be. These are great for moving up in bed. These are great for turning in bed and stuff like that when you need to have access. The repositioning sheet that I showed you, if you're using the lift, sometimes it's great for repositioning and rolling, but sometimes if you're looking at that timeliness and needing to get the activity done more timely, it can get in the way and there's just more steps, where this potentially could give you more timeliness in that task. The difference between the two is the repositioning sheet has a breathable property to it, so it can be left underneath the individual. These cannot be left underneath an individual. Also keep in mind that because they are very slippery too, there's a safety issue as well, and so making sure that they're not left underneath an individual for that reason as well. Okay, so I'm going to lay down and show you just kind of how easily I can move around on them. So if I have my feet on the mat, you can see I can slide up and down pretty well. I can roll. So lots of different things that you can do on them. You can work on scooting on the edge of the bed with them. It just, again, helps decrease that friction that you are fighting against, or your patient's fighting against. So they might have quite a bit of movement and mobility, but yet they don't have like the motor planning that they need potentially yet to be able to figure out how to do all of that movement or that combination of movement at the same time. So sometimes by decreasing the friction, it just allows them to have a little bit more success. And you'd be like, oh yeah, that's what it's supposed to feel like, without having to like really fight against the surface that they're on, right? So even sometimes like working with individuals with spinal cord injury and they're working on leg management, having them being able to access or being able to move that leg and try to keep that balance can be a benefit there too, versus trying to fight against the mat surface. you want to try to give individuals some success while they're learning a new task. And as that gets easier, then you can add more challenge to it, like the mat surface. But I feel like if you can give them some success and that they know what they can do or how that movement's supposed to feel, then it allows them to be able to be more successful with more of those challenging things versus just getting frustrated over the mat surface of not being able to move that leg for whatever it might be. So another great tool to use. Again, there are some safety issues, so you want to just kind of keep that in mind too. You don't necessarily have to use it for repositioning or transfers or anything like that too. It could just be simply used for a closed chain exercise. So let's say you have somebody who really likes to push this direction. So they have a really strong side that they're pushing this direction and you want to try to get them to go that way. So maybe having them weight shift, but you don't want them to get stuck, but to keep going, you could have them go this direction and it allows them to slide in a sense. Or if you're just working on some closed chain where you're trying to work on some range of motion type movements as well too, would allow you to potentially use something like this to help. From a physical therapy standpoint, I really like these for leg exercises because it allows me to have the patient be more successful at using their leg, or it takes the load off of me having to lift the leg up to take it through the range of motion, where I can just have them, in a sense, slide it. If I'm worried about their heel being protected with the friction, this helps decrease that friction that they're going to have on the bed surface. But if anything, I can always put my hand underneath the heel and then my hand can slide on the surface versus it kind of running onto the bed surface too. So a couple things with that as well too. But again, like you can see, like the possibilities are kind of endless with some of this stuff. You just kind of have to be creative and be willing to try and kind of think outside of the box as well too with a lot of this stuff. A gait belt. So all of these are pretty familiar with gait belts just because we use them in this type of work. So typically, you want to try to get it down around the waist as snug as you can, because as soon as you lean forward or stand up, a lot of times it gets loose. Stuff in this area has a tendency to redistribute when you're standing versus sitting. So kind of keep that in mind as well too. Also keep in mind the task that you're doing with them as well. So if you have a patient that has something in their stomach and they're asking you to put the gait belt up underneath their arms, just keep in mind that it's really not going to do you any good up here because their center is down here. So if you have a patient in your facility requires you to have the gait belt on, I would still suggest potentially holding on to their pants or their hips of some sort when you are asked to put it up here, because again, if they're going to fall or something like that, God forbid, we don't want that to happen, but maybe you're going to have more control over them if you have your hands kind of down more of their pants or their waist too. So if you can't keep it here, try to grab on here. Honestly, I sometimes will grab the pants and the belt because a lot of times our patients don't have great pant management, and halfway down the hallway they end up at their knees. So that's always something else to think about as well too, is clothing management. Maybe you try to use the belts to help with the pants, but then it's really low. But anyways, just a tip there. Something else to think about too with the gait belt is sometimes doing those slide board transfers or even trying to get to that lift off position where the person's kind of in that squat, but kind of lifting up and getting them to load those legs. Sometimes with that gait belt, what happens is when we go to transfer them or help them with that, it just slides up, right? So we have our hands back here and it just slides up. So a technique that I'm going to show you can do is taking your gait belt and kind of slipping it underneath their hips a little bit. So I always say when I teach this to think about kind of how your seatbelt comes across the lap in your vehicle versus your stomach. And so then you kind of have it in a good position. And so that way when you grab onto that gait belt and you come forward, you're going to get that better lift, and that gait belt's not going to necessarily slide. You don't want to do this if you're going to work on standing because the gait belt's just going to go down. But if you're really just trying to work on getting that lift from that hip, You're trying to get their bottom up off of the surface, this might be a really good technique for you to certainly try, so that you can be more successful at trying to get them to weight shift onto their legs. So why would weight shifting on their legs be important? Because that's going to make it less stressful for you when you go to try to transfer them. So if you are standing up with somebody and you're kind of like this, with your arms kind of length away, using your neck and your back, it's going to be a lot harder than if you get closer to that person and kind of weight shift back. So if you can weight shift back onto using your legs, weight shifting their body onto their feet, it's going to make a huge difference in that transfer than if you're trying to struggle to do it like this. So just some things to kind of keep in mind. Just a few tools that you might find out in the clinic. Certainly, there's a variety of different things, and this is just certainly just kind of the tip of the iceberg, but just anyway, some things to kind of keep in mind. Thank you.
Awesome. Love it. Love it. You're so good at this. Love it.
I hope that was okay. I
It was great.
I'm sure I said like a million times. There's going to be somebody doing a tally. And I'm like,
No, it's all very interesting. Great info. Let's demonstrate really quick how to get a sling under someone.
Oh, kind of like rolling?
Yeah.
Yeah. Okay.
Okay, so let's say that I am a bariatric patient.
Okay.
And I am in bed, and we're going to get out of bed, first putting the sling underneath.
Okay.
So we'll just demonstrate the whole process of how you would tell a person's in their new bed, how you need position the sling, and step that process out.
Okay, so if we were going to transfer somebody of size, so somebody who is, let's say, maybe 300 plus pounds, again, depending on their situation, they might move really, really well. One thing to also consider is that sometimes people have their own movement patterns that they've had over the years that work for them, and if you're trying to potentially change that, it's not going to go well. So again, if they can go back to that movement pattern, even better, but I understand certainly there are times that they can't. So if you are going to roll somebody, obviously this mat is stuck here, but we would want to increase the height of the mat so that we're not bending over and stooping. If we were going to have Farrah roll towards the wall or any direction, typically if the patient can, you're going to want them to bend their knee to either help push with their hip or cross the leg. So that's going to help bring that hip across or over onto their side. You can also cue them if they're able to reach across with their arm for like the bed rail if that's appropriate, or even just bringing that arm across their body is going to help with that trunk movement. Okay, so we're going to have her bend her leg up. If she's able to help kind of push to lift that hip up, even better, and then cueing them to reach across their body to help either pull on the bed rail if they're able to do that, if they don't have any precautions where they can't use their arm, that type of thing, but then that allows them to get on their side. Also with the leg too, if you even just crossing the leg, just the weight of the leg is going to help them be able to achieve more of that sideline position. Okay, so then you have your horseshoe sling, and we're going to put it underneath her. So again, kind of lining up that horseshoe part, that loop, or that kind of arc. You're going to want to put it kind of at her tailbone or where her sacrum is. And one way you're going to kind of just get it close underneath there. One way of kind of measuring that I sometimes will do is you can kind of just see kind of where it's kind of hit on her to know if you have it tucked too far underneath or that sort of thing. As well. So you're just going to kind of tuck it underneath And then you're gonna have them roll back. So you can certainly help them if they're not able to, that type of thing. And then we're gonna repeat that over onto the other side. So it's always good to do most of these tasks with 2 people so that you have kind of a safety person. So we did really great rolling that way because we have this huge mat in the wall, but coming this way where you don't have any railings or something like that, certainly if you were by yourself, you'd want to put both railings up on the bed or have that extra person standing there just to make sure that that body weight doesn't necessarily propel them farther to the floor. Certainly once you start that weight shifting, you get to a certain point where it might just potentially carry that person more forward than you were expecting. So having the bed rail there or having that second person there could be helpful. So again, having her bend her knee up or having her cross her leg and then coming across, and then you're gonna pull the rest of your sling out. So then when she rolls back, it's in the position that it needs to be. You come up underneath the legs. And then you would cross them and then up you go. Now again, this is the type of lift system or sling that we have at my facility. So again, when you get to your facility, you would want to just make sure that you're checking with what kind of system they have, because some systems just, you cross them differently or hook up differently, that type of thing. So just kind of being aware of that, but this is just one type that you might see.
And then taking it out, same thing.
Yep, so if you wanted to take it out, you're gonna have her roll again to one side. You're gonna shove it. I don't know if shove it's a really good word, but tuck it. You're gonna tuck it underneath them. A lot of times I'll warn them, okay, roll back. You're gonna feel a little bump, and then they can roll the other side, and then out it comes. Certainly you might have to maybe help manage a leg or an arm or kind of maybe help lift their head. Again, depending on how dependent the person is too. So.
Yes, very good. Okay. Great for them.